one position before I move the limb position. For some reason, I enter an EDC, so then I got to do it anyway. But that's just kind of the way I think. It helps my brain work through the muscles, and I know the order I tend to do things in. It helps me keep track of abnormalities in terms of schemes. So I usually try to do that and try to have them move as little as necessary. So try to be just efficient with their movement in a sense, through no real, probably legitimate scientific reason. I just think it may be a little bit more comfortable for them. Triceps again, I usually go for the lateral head, which is fairly big. Should be able to feel it in most people. So I come up from the epicondyle, a good hand breadth, and push on my hand real hard. You can feel it pop out in most people. Relax. Even thin folks, where it's not as broad, it's pretty prominent in this area. You want to do it in the distal third of the arm because it's more superficial there. If you go more proximal, it's a little deeper to the subcutaneous tissue in some people, and then you start getting problems where it's underneath the deltoid, things like that. So I stay in the distal third of the arm. And then a little pinch. Now the other thing about the triceps is its units are larger than other arm muscles. So they are naturally kind of bigger units, basically. All right? Okay. So if you kind of lose sight of that, sometimes you might get fooled when you're just listening and hearing a bigger muscle, thinking, okay, that's an abnormal unit, when it's actually normal for the triceps. Okay? The tibialis and the vastus medialis are also muscles where that's the case. So kind of grade them with a different normal set than other muscles. Okay. Now, two good ways to activate this, depending on what's working for a particular. One is to just push on my hand a little bit, right there. Those are nice and crisp and sharp. And then relax. And then the other way to do it, if that's just getting too much or too little of an activation, you can't gauge it that well, have them relax all the way down. There you go. Have them just pick your hand up, straight up. That a lot of times will give you nice isolatable units if you just have them pick the hand up off the chest, because they're maintaining a little bit of a posture there. It's a lower level of activation than trying to push. Okay.